Hey chiropractors, good morning. Dr. Terrence McAuliffe here, Terrence McAuliffe, DC. I was just reaching out, a couple things I was thinking about. What are the best things in practice, in chiropractic practice, to determine and use as tools to track long-term damage to the nervous system, subluxation, nerve interference, all those things. My opinion, there's two tremendous ones. Number one, the lateral cervical x-ray. Number two, posture. The third one that's wonderful to prove in practice to your patients is palpation. So the lateral cervical, what a great tool. So that loss of the proper lordosis, degenerative joint disease, all reflective of long-term misalignment, poor motion, intersegmental motion, nerve interference, first nerve off the spinal cord, off the nerve root, back to that disc, right? Back into that cord. All critical. So you can use it. We're seeing more degenerative joint disease in younger people than ever before. It's also a tool if you do learn technique and you work to improve curve that you can demonstrate it's changing. Posture. We used to be the posture experts. I don't know what happened. But posture. If you think about the neurology of posture, the balance of the system, front to back, from the side, gives you incredible insight to long-term damage. Talking about balancing of the brain to the body and back. Remember, we need lots of input for that from the nervous system through the spine, which needs to be uninterfered with. Also a wealth of receptors and other communicators in the spine. The spine is an organ to help give that brain the input, the insight, the knowledge it needs to make decisions. Most of our body is sensory dependent, receptor dependent, sensory driven, and we need that input. Then finally, here's the coup. Palpation to prove in the practice. So you can use the posture, you can use the x-ray, and you should. Those should be in your evaluation and you can recheck them. But on a day-to-day basis, palpation is so positive to show to the patient you know where their problems are. You know where their subluxation, nerve interference, joint dysfunction, all other discussion words we can use. But you can palpate and say, there it is. That's what I need to adjust, whether you're using your hands, an activator, impulse adjuster, arthrostim, again, other topics. But the touch, the connection, then the intent of the healing becomes so powerful. And you have these wonderful tools that you can recheck. Here's the key, though. If you're taking a lateral cervical and talking about curve and talking about degeneration, you should reshoot that picture to see if you're getting it to change. You've got to decide with your technique, with your ability, how often. CBP has protocols, other techniques have protocols, but you should recheck it. Same as posture, same as palpation. Oh, what a great fun you can have with that. All right, lateral cervical, posture, prove it with palpation. Hey, and adjust over and regularly, over and over and over. All right, Dr. T out.